Okay, so the answer to that question would have been 00528 in exercise 16.1. Number 1 is 00528. Good job. Alright, so let's go on now to page 505 in the textbook. You want to be on 505. And in the coding manual, in the CPT, we want you on page 554. Excuse me, CPT page 54. 54. So we're going to discuss time reporting. So time for anesthesia procedures may be reported as customary in your area. But here's the point. On page 54, CPT manual under time reporting. Anesthesia time begins when the anesthesiologist begins to prepare the patient for the induction of anesthesia in the operating room or in an equivalent area, and it ends when the anesthesiologist is no longer in personal attendance. You must know the definition of anesthesia time. It is probably going to be a test question on Blackboard, and it may even be on your exam. We don't need to worry about surgery time when we're coding anesthesia. The only thing that's important is anesthesia time. We also have anesthesia modifiers that we did not discuss earlier tonight. These modifiers can only be used in anesthesia. So in the CPT manual on page 55, you will see modifier P1 to P6. So P1 is for what type of patient? A healthy patient. If your doctor tells you they're normally healthy, that's going to be a P1 modifier. P2 is a mild systemic disease, while P3 is severe. P4 is a constant threat to the life. P5, the patient is not expected to survive. P6, they're already brain dead. So you may need to use these modifiers. Also, you have something called qualifying circumstances. And qualifying circumstances are add-on codes and cannot be used alone. If you know the patient's age, they are younger than 1 but older than 70, you can use 99-100. But there are times you cannot use this code. When? Well, let's take a look at 00326 on the next page. 00326. And underneath that code in the parenthetical note, it says do not report 00326 with 99-100. Do you see that? So underline or highlight that direction. There are times you're asked not to use this code. There are other qualifying circumstances like hypertension, emergency conditions. So it depends on the scenario. All right. So please turn your textbook to page 510. And we would like for you to do number 4. The question is, which of the following physical status modifiers best describe a normal, healthy patient who is undergoing anesthesia? Page 510, question 4. Very good. P1 describes a healthy patient, so the answer to 4 is D. Let's try one more. Number 5 on page 510 says a 67-year-old patient is undergoing anesthesia for reoperation after coronary bypass surgery 2 months ago. Which of the following qualifying circumstances may be separately reportable? This is a qualifying circumstance, so it would be one of the add-on codes. None of the above actually is the answer because none of them qualify. If you turn back to page 509, beside question number 1, please see page 505, paragraph 2 for the answer. Just want to give you that tip. 505, paragraph number 2, paragraph 2. And for question 6, please look on page 508. Okay. So now let's take a look at the modifiers. We want you to turn your book to page 512. And I mentioned these modifiers earlier. We can find them in HCPCS. But if you are getting anesthesia services from the anesthesiologist, notice that AA is one of the modifiers. AD is a modifier, and you're going to read about all of these and what they mean. QK, QY, and GC, QY and QZ, QS, G8, and G9. I want to encourage you to read all of this information regarding the modifiers. But for practice, we're going to look on page 514, and we're going to read number 1. And it says a 78-year-old is undergoing lens surgery for cataracts. An anesthesiologist is performing monitored anesthesia care personally. Which modifiers are appropriate for the anesthesiologist? Which book do you need to look up the modifiers in? HCPCS. So get your HCPCS. Find your modifiers and tell me which answer would be correct. What page did we say that was on? 333, is that right? For the HCPCS 2016? No, 369. So if you could actually start with QK. That's the way to do it, Dorothy. Start with QK. And if that's not what they said in the scenario, then you can't use that modifier. I think it's page 369. Ashley, work on the question number 1 for me, please. You just did it? All right. Okay, the answer would be C. And the reason why, if you look at QK, QK says medical direction of 2 or 3 concurrent procedures. Did he tell you he did that? No. QS would have been your next option, monitor anesthesia care. Now that could have been correct, but the problem is it left out what? the AA, because remember we learned when an anesthesiologist is doing the procedure, we have to use modifier AA. That is also why D is not right, because D leaves out the monitored anesthesia care, which is QS. So 0142, AA says it was done by the anesthesiologist, and QS says it was monitored anesthesia care. Okay? Now, you'll be able to go over that again when you do the reading. Keep in mind, this is the first time we're hearing this tonight. Right?